because we need everybody to be sure about the question pattern. Correct? Last two sessions, we have been trying to help you out how to prepare your strategy, because each and every candidate should evolve own strategy. Whatever works for somebody else need not work for you. So may I invite Dr. Srividya to run through the section A questions on topic. Yeah. So section A, single best answer. Please go ahead.
Okay. So question number 1, administration of succinylcholine 1 milligram per kilogram to a pregnant woman rarely causes fetal neuromuscular blockade. Which characteristic of the succinylcholine best explains this phenomenon? Option A, high protein binding. Option B, ionization. Option C, lack of passive placental diffusion. And option D, lipid solubility. So choose the best answer.
I hope the poll window is on. You can just click on the options. Feel free, because all the answers are anonymous. Only you will be knowing whether you got it right or not. But it's best to attempt. Okay. Today we'll be going slightly faster with section A. I think we started with a fairly easy question. So you can click only one choice. Okay. I'm ending the poll. Okay. So this is the results part. I think the trend is also visible. Srividya, please.
Yes. Yeah, I can see the trend, and okay, most of them
went for option C, right?
Option C. Okay. Shall we see the answer? The answer is D. It is due to the high ionization of the succinylcholine. It won't go through the placenta. As you know, succinylcholine is a depolarizing muscle relaxant, and it is a quaternary ammonium compound which has got a pK of 7 to 7.1. So in physiological pH, 80 to 90% of succinylcholine exists in its ionized or charged form, which won't cross the placenta. Coming to the option A, it has got high protein binding. Actually, succinylcholine has low protein binding. About 20% only is protein bound. Third question, which everyone has answered, is technically correct. Like succinylcholine can technically diffuse, but its ionized state prevents its effective transfer. And since it is ionized, it is not lipid soluble. So the best answer is it is exists 80 to 90%. It exists as ionized compound. So coming to the next question. 1 month-old infant becomes hypoxemic faster during apnea than an adult. Which of the following is the primary cause of this difference? Option A, functional residual capacity in an infant is half that of adult. Option B, metabolic rate in an infant is twice that of an adult. Option C, resting PO2 in an infant is lower than that of an adult. And option D, the number of alveoli in an infant is 12% of the number of an adult. Choose the best one. So, yes.
You should have a strategy how much time you are going to spend for each question in section A, section B, and section C, because B and C, I think, might take up more time. We need to be quick with section A. So this is the response part.
Okay, most of them have answered as correct answer as A, but 21% has answered as metabolic rate. Infant is twice that of adult.
Again, best response was deceiving.
Yeah.
Majority thought it's A.
Most of these responses are correct. But what is the reason for faster desaturation? That is the key point in that question. So the answer is B, because it is because of the higher metabolic rate. So as you know, infants have oxygen consumption of 6 to 8 ml per minute, whereas in adult it is half, that is 3 to 4 ml per kg per minute. So they burn through their oxygen store, that is FRC, much quicker than adult. That is the reason for rapid hypoxemia in infants. Coming to the first option, that is FRC in infant is half that of adult. Actually, that is an incorrect option because FRC is actually similar between adult and infants according to their age. Coming to the option C, resting PO2 in an infant is lower than that in adult. The statement is correct. Infants have slightly lower PO2 of 60 to 70 millimeter of mercury compared to the adult, that is 90 to 100. But that is not the reason for their faster desaturation. And option D is the number of alveoli in infant is 12% the number in adult. That is also true. The newborns have fewer alveoli, like about 20 to 50 million, versus adults have 300 million alveoli. And they are having efficiency in gas exchange. But the main reason why they desaturate during apnea is because of their higher metabolic rate and oxygen consumption.
Okay, we'll move to question number 3.
A 26-year-old woman has headache, nausea, and photophobia 36 hours after cesarean delivery for a chorioamnionitis using subarachnoid block. Temperature is 38.8 degrees Celsius and leukocyte count is 14,200 per millimeter cube. Which of the following is the most appropriate next step in the management? Option A, oral ibuprofen. Option B, intravenous hydration. Option C, epidural blood patch. Option D, diagnostic lumbar puncture. Your time starts now. What is the most appropriate next step in the management? It's a single choice question. Most of them has answered intravenous hydration. That is not correct. Answer is diagnostic lumbar puncture. So let us break down this clinical scenario. It's a 26-year-old woman having headache, nausea, and photophobia 36 hours after the delivery. It may sound like PDPH, but that is the point is she has got temperature of 38.8 degrees Celsius and leukocyte count of 14,200. That is not typical for PDPH. Fever and elevated WBC count shows features of post-spinal meningitis or spinal abscess that should be ruled out. So what is the next step? A diagnostic LP. So diagnostic LP should be done to differentiate between meningitis, which can be bacterial or aseptic. And PDPH LP is usually not done. The other measures are done. And the other option is spinal epidural abscess that may have back pain or neurological deficit, but fever still warrants investigation. So the point is, it may sound like PDPH, but that is not the answer. That is why ibuprofen hydration choice. The next step should be lumbar puncture. Okay. So question number 4 is, which of the following changes in pulmonary function best explains the more rapid rate of rise of alveolar concentration of volatile anesthetics in pregnant women than in non-pregnant women? So option A is decreased FRC, B is decreased dead space ventilation, option C increased cardiac output, and option D increased oxygen consumption. So what is the reason for rapid induction in pediatric patients? So why do pregnant woman has faster rise in alveolar concentration.
Okay, time to end the poll. This is
So,
the trend.
okay. Okay. So 38% has answered decreased functional residual capacity, and that is the answer for it. Actually, 44% has answered as increased cardiac output. Actually, the increased cardiac output washes away the anesthetic agent from the alveoli into the circulation. That will reduce the speed of induction. So the correct answer is actually option A, decreased functional residual capacity. So pregnancy makes so many physiological changes in pulmonary system, and one is decrease in functional residual capacity, decreases by 20%. So what happens is, since the FRC is smaller, the anesthetic concentration build up faster, leading to a more rapid induction of anesthesia with volatile agents like sevoflurane, bisflurane, etc. So there is high alveolar to FRC ratio, so there is faster rise in FA by F5. About the option B, dead space ventilation, dead space doesn't significantly change in pregnancy. And increased cardiac output, as I mentioned, it actually washes anesthetic away from the alveoli into the blood faster, slowing the rate of alveolar buildup. And increased oxygen consumption has nothing to do with the speed of induction. It is mainly increases the hypoxemic risk. So the correct answer is A, decreased functional residual capacity. So question number 5, compared with use in adults, routine use of succinylcholine in children is hazardous because of the increased risk of which of the following? Option A, anaphylactoid reaction. Option B, phase 2 blockade. Option C, pseudocholinesterase deficiency. And option D, undiagnosed myopathy. So why it is not recommended to use in children? Option A, anaphylactoid reaction, phase 2 blockade. C, pseudocholinesterase. And option D, undiagnosed myopathy. So correct answer is very good. Most of them has answered as undiagnosed myopathy. That is the correct answer. So as you all know, succinylcholine is a depolarizing muscle relaxant. It attaches on the nicotinic acetylcholine receptors, which produces depolarization, prolonged depolarization, which produces potassium out of the cell into the bloodstream. So in children with undiagnosed myopathy like Duchenne muscular dystrophy, they have upregulated extrajunctional acetylcholine receptors due to chronic muscle degeneration and regeneration. So when succinylcholine is administered, massive potassium efflux occurs, leading to severe hyperkalemia, which can lead to arrhythmia and sometimes to cardiac arrest. So this is often the first clinical manifestation of undiagnosed myopathy in children. So it is not recommended to use routinely in pediatric patients. Sixth question is, maternal hyperventilation to a PaCO2 of 22 millimeter of mercury during labor can result in option A, decreased fetal trapping of local anesthetic. Option B, fetal respiratory acidosis. Option C, fetal metabolic acidosis. And option D, uterine vasodilatation. Choose the best answer. So maternal hyperventilation to 22 millimeter of mercury, what happens to the fetus or to the uterus? So the answer, okay, 67% people have answered right. It is fetal metabolic acidosis. As you all know, when the mother hyperventilates, the carbon dioxide is washed out, resulting in a decrease in PCO2 and alkalosis of the blood, which can produce vasoconstriction of the uterine and placental vessels, reducing the uteroplacental blood flow, of decreasing the oxygen delivery to the fetus, leading to fetal hypoxia. So whenever there is fetal hypoxia, there is decreased oxygen delivery to the fetus, which will start the anaerobic metabolism in the fetus, leading to accumulation of lactic acid and fetal metabolic acidosis. So the option C, fetal metabolic acidosis, is the correct answer.
I think now Dr. Rashmi will continue.
Yeah, thank you. So the next question for you all to answer is, by how much value will the factor 8 concentration increase with the administration of 1 unit factor 8 clotting activity per kilogram body weight? 5%, 10%, 2%, or 8%? Please choose the single best answer. Here are the options in front of you on your screen. 5%, 10%, 2%, or 8%. Okay, so I can see that 9% people have given the correct answer, and the correct answer is 2%. So if you administer 1 unit of factor 8 clotting activity per kilogram, you will be able to raise the factor 8 concentration by 2%. So depending upon the factor 8 percentage deficiency, you can decide the number of clotting factor 8 clotting activity per kilogram that needs to be given for a patient with hemophilia. Next question. So second question, eighth question is, what precautions should be taken in a patient with sickle cell disease undergoing surgery? Avoid hyperventilation, avoid alkalosis, prevent anemia, or all of the above. This is again a single best choice question. Please pick one best choice out of all these 4 choices. Avoid hyperventilation, avoid alkalosis, prevent anemia, or all of the above. So people have chosen all of the above as the most commonly answered question, most commonly picked up choice. But the answer is option number C, that is prevention of anemia. There was a confusion, which has actually, there was a distraction in the options, which was a good distractor for you all. So it is avoid hypoventilation. Okay. So you need to avoid hypoventilating in a patient with sickle cell disease, because hypoventilation will cause accumulation of CO2 and it will cause acidosis. Acidosis needs to be avoided at all costs, because that will precipitate sickling. So avoiding hypoventilation, avoiding acidosis is the correct answer, and prevention of anemia. So avoidance of alkalosis is not the right answer, and avoidance of hyperventilation is not the correct answer. So all of the above is not the right choice for this. The next question is, a patient who has received the following chemotherapeutic agent has a very high likelihood for pre-op cardiac dysfunction? Option A, azacitidine. Option B, trastuzumab. Option C, bortezomib. And option D, pemigatinib. Single best answer type question. Only one answer is the correct choice. One answer. And the correct answer, can we have the results? Okay, so 29% have given the answer as option B, trastuzumab, which is the correct answer. All the other three chemotherapeutic agents have less chances of cardiotoxicity. A patient of cancer pain was receiving 10 milligram of intravenous morphine. He now has to be switched over to oral therapy. How much oral morphine would you prescribe to this patient? Option A 10 mg, option B 15 mg, option C 20 mg, and option D 25 mg. So to correctly answer this question, you need to know the equivalent dose of morphine, the IV equivalent to oral equivalent dose of morphine. If you know that, you will be able to answer it correctly. So the correct answer is 25 milligram. And I can see that 28% have given the correct answer. So 2.5 is to 1. That is the ratio of oral morphine to IV morphine. So IV morphine, if 10 mg is effective for a particular patient, then 2.5 of that is the oral dosage. So that makes it 25 milligram of oral morphine. Next question. Which anesthetic modality should be avoided in a patient with sickle cell disease? IVRA in option B, brachial plexus block, option C, general anesthesia, and option D is subarachnoid block. These are very clinically applicable questions and very simple questions. I can see that most of you have answered it correctly. IVRA should be avoided because it involves the use of tourniquet and stasis of blood, which is not to be done in case of sickle cell disease. The other three options can be used safely in such patients. Next question. I think this is Dr. Srividya.
And Dr.
I'm
Anantha.
not sure. Okay, Dr. Anantha. Okay.
We'll go to the next question. Which blood test is most useful in monitoring heparin therapy perioperatively? Your options are option A, prothrombin time, option B, APTT or activated partial thromboplastin time, option C, fibrinogen level, and option D, bleeding time. So one of these tests is most commonly used to monitor perioperative heparin therapy. You have to choose which one of these investigations is the most appropriate to monitor heparin therapy. So 79% of you have answered the question correctly. That is activated partial thromboplastin time, option B. So to monitor heparin therapy, APTT is routinely done, and it is one of the investigation that is used to monitor the intrinsic as well as the common pathway of coagulation. Moving on to the next question. Which of the following is a sign of adequate preoperative preparation in pheochromocytoma according to Roizen's criteria? So the options are A, heart rate less than 120 beats per minute. Option B, absence of ST-T wave changes for 1 week. Option C, plasma metanephrines normalized. And option D, serum potassium more than 5 milliequivalents per liter. So here you have to choose the option that is part of the Roizen's criteria. Option A is heart rate less than 120 beats per minute. Option B, absence of ST-T wave changes for 1 week. Option C, normalization of plasma metanephrines. And option D, serum potassium more than 5 milliequivalents per liter. So here there is some discrepancy among you regarding the correct answer. So here the correct answer is option B, that is absence of ST-T wave changes for 1 week. So Roizen's criteria is used to assess the adequacy of preoperative alpha blockade before pheochromocytoma surgery, and its components are no in-hospital blood pressure more than 160/90 for 24 hours prior to surgery, no orthostatic hypotension with blood pressure less than 80/45 mmHg, no ST-T wave changes on the ECG for 1 week prior to surgery, and no more than 5 VPCs per minute. So here you can see that option B is the correct answer. The next question is, the oculocardiac reflex is mediated by which cranial nerves? Option A, cranial nerve 2 and 5. Option B, cranial nerve 3 and 7. Option C, cranial nerve 5 and 10. And option D, cranial nerve 7 and 9. So which of the following cranial nerves mediate the oculocardiac reflex? The poll is closed. 74% of you have answered the question correctly. That is option C, cranial nerve 5 and 10. So the afferent for the oculocardiac reflex, that is bradycardia when there is any pull on the extraocular muscles. The afferent is a trigeminal nerve, and the afferent is the vagus nerve, that is cranial nerve 10. The correct answer is option C.
So coming to section B, which is multiple response type, more than one question, one answer may be correct. So supine hypotension syndrome of pregnancy, option A begins at 32 weeks of gestation. Option B causes fetal distress by iotocaval compression. Option C is corrected by Trendelenburg's position. Option D occurs in 8 to 10% of the supine woman at 38 to 40 weeks gestation. So there are 4 options. More than one response may be correct. Begins at 32 weeks, causes fetal distress by iotocaval compression, corrected by Trendelenburg position, occurs in 8 to 10% patients, supine woman at 38 to 40 weeks. Response. Okay. Option B, 100% has answered it correctly. And as I told you, there are multiple responses for this question. and 67% has answered option D. So the answer correct are option B and D. So that, as you all know, supine hypotension syndrome can it causes fetal distress by itocaval compression. The gravid uterus compresses the inferior vena cava and abdominal aorta, reducing the venous return to the heart, decreasing the cardiac output and uteroplacental perfusion, leading to fetal distress. So that is the correct response. What about option A? It begins at 32 weeks of gestation. That is incorrect because it can come it can have any time in late pregnancy, but it is more common after the 20 weeks of gestation. But it doesn't specifically start. That is the begins at 32 weeks of gestation. That is the wrong part of that statement. And what about the C, option C? It is corrected by Trendelenburg position. That is incorrect because that will actually worsen the condition by further displacing the uterus towards the diaphragm, increasing the pressure on inferior vena cava. Actually, what is needed is left lateral tilt of about 15 to 30 degrees to the for the mother. And about option D, it occurs in 8 to 10% of the supine women at 38 to 40 weeks. That is correct. And 8 to 10% of the women can have symptomatic supine hypotension syndrome, and more can have asymptomatic supine hypotension syndrome by 38 to 40 weeks. So there are two responses, B and D are correct.
Shall I take a moment to explain the partial scoring at this point? So here there are two correct options. Okay. B and D together will carry 4 marks. So if you click on B, you get 2 marks. If you click on D, you get 2 marks. Okay, 2 plus 2 is 4. So if you want to take the full 4 marks, you need to click B and D only. Suppose you click on A, what happens? So wrong options are A and C. Both the wrong options together will carry 1 mark negative. So if you click on A by mistake, you'll be penalized by 0.5 marks. If you click on C, again you'll be penalized by 0.5 marks. Clear? This is the partial scoring. So if you click only B, you get +2. If you go wrong by clicking A, minus 0.5 will be cost. Okay, 0.5 marks will be deducted. So you'll end up getting 1.5 marks. Okay, we'll proceed to the next question.
Okay. Question number 2 of multiple response question. Compared with adults, caudal anesthesia in children is associated with option A, lower risk for subarachnoid puncture, option B, less severe hypotension, option C, more rapid onset of sensory block, and option D, smaller volume of anesthetic per kilogram of body weight. So you have to choose the multiple response. Multiple, more than one may be correct. Response, please. Response. Okay. 73% each has answered. Answer B and C are correct. That is the correct answer. Answer B and C. So compared to the adult, in infants or children, they have less severe hypotension and they have their faster onset of sensory block. So the option A, why is it incorrect? Because they have higher chance of subarachnoid puncture because the dural sac extends lower in neonates, like up to S3 to S4 compared to S1 and S1 to S2 in adults. The option B is correct because the sympathetic nervous system and baroreceptors are immature in pediatric patients and they rely more on the heart rate to maintain the cardiac output. So they get less severe hypotension. Option C is correct they have more rapid onset of sensory block because their cardiac output is more. So their uptake and distribution of local anesthetic is fast. So they have fast onset of sensory block. And their epidural space is also smaller and more compliant. That also helps in quicker spread of local anesthetic agents. Regarding the option D, why is it incorrect? Because they need more amount of local anesthetic for the regional anesthesia, like it is 1 ml per kg for sacral block and 1.25 ml per kg for thoracolumbar block. It's because of their particularity of epidural fat and vascularity. It is different than adult. So the options are, there are two options. Two options are correct, that B and C. They get less severe hypotension and more rapid onset of sensory block compared to adults. Next question.
Ashmi can take over.
Yeah. So the next question is, which of the following is or are the components of factor 8? Option A, factor 8A. Option B, factor 8B. Then option C, factor 8C. And option D, factor 8 von Willebrand factor. So more than one correct options for this answer. So please choose. All correct options will fetch you full marks, and if you pick the wrong answer, you will be penalized by deduction of 0.5 marks for every wrong answer. So the answer is factor 8C and factor 8 von Willebrand factor. These are the only two components. So there is no component like factor 8A or factor 8B. Factor 8C is deficient in case of hemophilia, and factor 8 von Willebrand factor is whenever it is deficient, then it causes decrease in platelet adherence to the collagen, and that is how it causes clotting deficiencies. So the two components are factor 8C and factor 8 von Willebrand disease. Von Willebrand factor, which is deficient in von Willebrand disease. Next question is, the component of ERAS for colorectal surgery include PONV prophylaxis, surgical site drain, option C strong opioids for pain relief, and option D early ambulatory plan. There will be more than one correct option. Multiple choice answer, MCQ. Okay, so a large number of people have answered this correctly. So PONV prophylaxis, yes, very important in case of ERAS. And D, option D, that is the early ambulation plan. Use of surgical site drainage will itself lead to difficulty in movements at the later date, and your early ambulation is the goal in case of ERAS. And strong opioids for pain relief. If you give a lot of opioids, these will result in post-operative nausea and vomiting, as well as a little bit of drowsiness or respiratory depression. And that is precisely what you don't want when you are planning ERAS for cancer surgeries. So answer A, option A and option D are the correct answers.
So coming to the next question. Which of the following are appropriate airway management strategies in neonates and infants? Option A, use of uncuffed endotracheal tubes in neonates. Option B, maintaining spontaneous ventilation during mask induction. Option C, using a Miller blade for intubation. And option D, using a laryngeal mask airway as the first choice for all pediatric patients. Here you have to choose all the options that are appropriate airway management strategies in neonates and adults. You have 4 options. Please read the options very carefully before answering. The poll is closed now. So here the correct options are option A, B and option C. So 17% of you have answered option D, that is using a laryngeal mask airway as a first choice for all pediatric patients, which is not the case. Laryngeal mask airway can be used for airway management in pediatric cases, but it is not always the first choice, and it all depends on the case which you are dealing with. So option D is the wrong option here, and option A, B and C are all appropriate strategies for airway management in neonates and infants. Moving on to the next question. Which of the following measures can reduce the incidence of PDPH or post-dural puncture headache after neuraxial anesthesia? Option A, using a smaller gauge needle. Option B, performing the procedure with dura splitting spinal needle. Option C, encouraging early ambulation. And option D, encouraging resting in supine position. So you have to choose all the options which are appropriate for reducing the incidence of post-dural puncture headache. So which of the following options can be used to reduce the incidence of PDPH or post-dural puncture headache? Closing the poll. So the correct options are option A, B and option D. Here 12% of you have answered encouraging early ambulation. So encouraging early ambulation will worsen the post-dural puncture headache, but using a smaller gauge needle or performing the procedure with a dura splitting needle and also encouraging the patient to rest in a supine position will all reduce the incidence of PDPH. So the correct options are option A, B and D. The next question, which of the following are common causes of post-tonsillectomy bleeding? So you have to choose all the options which are common causes of post-tonsillectomy bleeding. Option A, sloughing of the eschar around the tonsillar bed. Option B, inadequate intraoperative hemostasis. Option C, coagulopathy or platelet dysfunction. And option D, use of dexamethasone perioperatively. So out of these 4 options, which are common causes of bleeding post-tonsillectomy? There are many causes of post-tonsillectomy bleeding. You have to choose which of these are common causes of post-tonsillectomy bleeding. Option A, sloughing of the eschar around the tonsillar bed. Option B, inadequate intraoperative hemostasis. Option C, coagulopathy or platelet dysfunction. And option D, use of dexamethasone perioperatively. The poll is closed. Now here the correct answers are option A, B and C. And option D, that is use of dexamethasone perioperatively, does not cause any post-tonsillectomy bleeding, but on the other hand is thought to decrease post-op inflammation and bleeding. So option A, B and C are common causes of post-tonsillectomy bleeding. We can move on to the next section.
Okay, right. Now we move on to section C, assertion reason type. I think now you are familiar with the plot of this section, because this carries maximum weightage when it comes to tiebreaker. Shall we proceed?
Okay. Come to the question number 1. The assertion is reduced systemic vascular resistance resulting greatest increase in right to left shunting in infants with cyanotic heart disease, like tetralogy of Fallot. And reason is in cyanotic heart lesions, a drop in systemic vascular resistance decreases the pressure gradient between systemic and pulmonary circulation, promoting more blood flow through the right to left shunt. So option A is both assertion and reason are correct statements, and reason is the correct explanation of the assertion A. Option B, both assertion and reason are correct statements, but reason is not the correct explanation for the assertion A. And C, assertion A is correct, but reason R is incorrect statement. And option D, assertion is incorrect, but reason is correct statement. So the assertion is reduced SVR results in increase in right to left shunting in infant with cyanotic heart disease. Reason is cyanotic heart lesions. A drop in SVR decreases the pressure gradient between systemic and pulmonary circulation, promoting blood through the right to left shunt.
Section C, those who are attended our preparatory session will realize that the options are fixed. Okay, the first option is going to be both are correct and reason is the explanation for assertion. B, the second option is both are correct, but reason statement does not explain. Third option is assertion is correct, reason is wrong. Last option is assertion is wrong, reason statement is correct.
Okay. Only 9%. And answer is C. Only 9% has answered it correctly. The confusion here is like actually the assertion is correct. Like when there is reduced SVR, that result in greater increase in right to left shunt in patients with cyanotic heart disease like tetralogy of Fallot. But the reason is incorrect because in when there is decrease in SVR, the gradient between the pulmonary and systemic circulation actually increases. Here it is shown as decreases. So that is the catch. So the assertion is correct, but the reason is not correct. So the option is C. So moving to the next question, the assertion is a woman with amniotic fluid embolism during general anesthesia is likely to have increased end-tidal carbon dioxide tension. And the reason, amniotic fluid embolism leads to severe pulmonary vasoconstriction, right heart failure, and impaired gas exchange, resulting in decreased carbon dioxide elimination and low end-tidal carbon dioxide. So option A, both assertion and reason are correct, and A is the explanation for R is the explanation for assertion. And option B, both assertion and reason are correct, but reason is not the correct explanation for assertion. And option C is assertion is correct, but reason is incorrect. And option D is assertion is incorrect and reason is correct. Paul, please. Okay, correct answer is D. 59% of the people have answered it correctly. So here you can see two contradictory statements. Like in the assertion, it is said that there will be increased end-tidal carbon dioxide concentration, and in the reason it is shown that it is decreased. Actually, in amniotic fluid embolism, the ETCO2 actually decreases rather than increases. because amniotic fluid embolism triggers severe pulmonary vasoconstriction, obstruct the pulmonary circulation, right heart failure, and impair the pulmonary perfusion. So, less carbon dioxide is transported to the lungs for elimination. That decreases the EtCO2 despite having a tissue metabolism. So, the assertion is wrong, but the reason is correct. In amniotic fluid embolism, EtCO2 actually reduces. So, our assertion is incorrect and reason is correct. Option D.
Okay, so the next question is, assertion says a patient has received platelet transfusion 4 hours back and has developed fever. And the reason statement is, febrile episodes are mild and common after platelet transfusion and respond to antipyretics. Options A, B, C, and D are the same as you have seen in the previous assertion reason type of questions. Can we see the responses? Okay, so what I can see here is that the correct thing is that assertion is correct, but the reason is incorrect. Why? Because assertion says that the patient has received platelet transfusion 4 hours back and has developed fever. This is a true statement because this is commonly seen in platelet transfusions because they are stored and transfused to the patient when the platelets are at a room temperature. Platelets are not transfused in the thawed state. So what happens is there is bacterial contamination in the platelets, which is quite common. So with platelet transfusion, if a patient develops fever within 6 hours, it is because of the platelet bacterial contamination. The reason says that febrile episodes are mild and common after platelet transfusion and respond to antibiotics. Because they are due to bacterial contamination, they will not respond to simple antibiotics. And because they are having the propensity to lead to bacterial sepsis in the patient's body, they should not be considered as mild and common after transfusion. So assertion A is correct and reason is incorrect.
So coming to the next question, the assertion statement is lidocaine infusion during cancer surgery may improve long-term survival, and the reason statement is lidocaine has anti-inflammatory and anti-metastatic properties that may reduce tumor progression. So the options remain the same. A, both the statements are correct and R is the correct explanation of the assertion. Option B, both are correct statements, but R is not the correct explanation of A. And option C, assertion is correct, but reason is incorrect. And option D, assertion is incorrect, but reason is the correct statement.
Requesting the delegates to just text in question number 4 and your answer, because the poll is not working now. Just text 4 and your answer. Put the question also, because next question also we need to do like that. So there are takers for option A. Option A.
As I can say, there are many delegates who are answering option A, which is the correct answer. Here, both the assertion and reason are correct, and the reason correct, and the correct explanation of the assertion is the reason statement. So, lidocaine infusion during cancer surgery has, in some studies, shown to improve long-term survival due to its anti-inflammatory and anti-metastatic properties. Moving to the next question. The assertion statement is PVC endotracheal tubes are preferred for laser airway surgery. And the reason is PVC tubes have a lower resistance to laser strikes compared to other materials. So here you can see two statements. You have to choose out of the four options. Assertion statement is PVC endotracheal tubes are preferred for laser airway surgery. And the reason is PVC tubes have a lower resistance to laser strikes compared to other materials. The question is open for answering for the
Number 5
delegates,
and
please.
option 5A, B, C, D, like that.
So I can see that many of you are answering option D, which is the correct answer. The assertion is an incorrect statement because PVC endotracheal tubes are not the preferred tubes for laser airway surgery because they are more prone for damage during laser airway surgery. But the recent statement given here is true. That is, PVC tubes have a lower resistance to laser strikes compared to other materials. So the correct answer here is option D. I think that brings us to the end of this session.
Okay, thank you very much. From the candidates again, if you want to clarify something, you can raise your hand. I'll enable your microphone. You can come out with your doubts, either with the exam pattern, the technical requirements, or the questions and answers we have discussed today. We'll have one more go, the practice session number 4, that will be on the coming Tuesday, the 25th of March, again 8 to 9:30. So we have already circulated the topics for that. So our faculty will be helping you with some model questions. It's not about the questions and answers. You should be thinking about how to reach the correct answer. Today, the best answer was missed out very commonly. So eventually what happens is only if you strike the best answer, single best answer in the section A, which will comprise of almost 70% of the exam, that is the scoring opportunity. Section B and C, you need to spend more time. The depth of knowledge is required. Again, be cautious. Every right answer will get you more points. Wrong answer will take away the hard-earned points. Okay, that we need to keep in mind. So I should thank today's faculty, Dr. Rashmi, Dr. Srividya, and Dr. Ananda Padmanabhan, for spending your time and supporting the candidates. The last 3 sessions, I believe, has been very much orienting to the candidates. And today we are also fortunate to have our technical experts to clarify regarding how the exam is going to be conducted. We don't want anybody to have any doubts about the technical part. Knowledge part, we can have a good contest. Technical part, everybody should be through. So the bottom line is you should have a good device, be it laptop, tablet, even if it's a mobile device, that's okay as per the technical requirements, but that should have a stable webcam and microphone. You should be in a quiet room. You are being proctored throughout the exam. So to finish the formalities, join 20 to 30 minutes prior to the scheduled time. So around 9:30, if you join, you can clear everything. Minor troubleshooting you can do. Definitely take the mock exam. That session is open on April 2nd or 3rd. At your convenience, you can join, have a go at the exam, feel the technical requirements, how to show the ID card, how to validate yourself, how to communicate to the proctor. These things you can be thorough. You'll be more confident. Then concentrate only on subject when you come to the actual exam day on April 6th. Join around 9:30, 9:35 like that. Clear everything. Then wait for a few minutes. Be cool. 10 o'clock exam starts and 12 o'clock exactly the exam will end. But you have the liberty to submit the answers early, especially if you want to come up in case of a tight score. Because It's basically a ranking exam among your peer groups. So from the faculty, anybody would like to give any comments? Baljit sir?
Well, Dr. Sunish, I was watching and listening very intently to all the questions and the answers. I think a lot of effort must have gone behind this. I can understand that. I can only compliment and congratulate you for a wonderful job that you have done, and of course today's faculty who were there to answer whatever questions were, whatever answers appear to be somewhat dicey for the students, because sometimes there appears to be two answers. Both appear to be okay, but then the faculty made it very clear that this is the right answer. I could see some of the answers, the students said that they had done. It was just 5% or 10%, whereas others were the incorrect answers. So hats off to the faculty for very clear explanation that they have given, and of course to the students who have participated. And I'm sure with this exercise and the last week's exercise also, the students would be quite familiar with the system now. And if they're familiar, they certainly will be able to do their best in the examination. So all the best to the students, and congratulations, Dr. Sinish, and the faculty for today.
Thank you very much, sir. So I know many postgraduate students are held up with their duty commitments and all. Do watch the recording when we upload it in the YouTube. The link will be shared in the WhatsApp group. But definitely make it a point whenever possible to join live and be part of this exercise. Document or record your response and see whether it is fetching you marks or whether it is likely to take away your score. Because you need to have a strategy whether you are attempting or not. Even if in multiple response, whichever option you are sure about, you can definitely answer that. And again, keep for review option is also there. So make use of the technology, make use of the exam format, and wish you all the best for a good ICA Olympiad being inaugural session. All of us together can make it a grand success. With that, I think we can conclude the session tonight. Thank you, everybody. Good night.